Okay, why don't we get started? Good day and welcome again to the WHO series on planning for sustainable financing. This is a multi-part webinar series to enable countries and multi-country stakeholders to develop pandemic fund proposals within the timeline allowed. Today's session is going to focus on monitoring and review of the process, and we have a couple of presenters that will be joining us. In the meantime, thank you for coming today. And if you don't mind, please go ahead and enter your name and where you're at today in the chat function so we can get an idea of who's tuning into these different webinars. If you have any questions throughout the session, please go ahead and enter those questions into the Q&A function. We won't be taking questions live on air, but rather taking your questions out of that Q&A function and then answering them today. So the specific objectives for today's session are to provide an overview of the Pandemic Fund monitoring and evaluation guidelines and associated templates. We'll also explain the international health regulations, monitoring and evaluation indicators, the framework indicators, and demonstrate how countries can utilize existing assessments to inform the selection of indicators for the Pandemic Fund proposals. We'll also outline the process for measuring animal health capacity improvement through the Pandemic Fund projects using joint external evaluations and then PVS indicators as well. So joining us in today's session are three presenters. We have Jamie Johnson-Darko, who will be joining us from the Pandemic Fund. We also have Peter Mala, who's an epidemiologist and evidence and analytics for health security here at WHO headquarters in Geneva. We're also joined by Ahmed Al-Nashbandi, who is with monitoring and evaluation and learning and a global coordinator at FAO. So happy to have everyone in today. So with that, again, as a reminder, please go ahead and enter your name and where you're coming from today, your organization and your country in the chat function. And if you have any questions, please go ahead and put those into the question function. My name is Melinda Frost, and I'm a unit head here at WHO headquarters with the Health Emergencies Program. And my unit is Learning, Solutions, and Training. So thank you so much for joining us today. So with that, I'll turn it over to Jamie. Jamie, thank you. Welcome.
Hi, everyone. Thank you so much for joining today. Today, I'll be talking a little bit about the monitoring and evaluation guidelines and template that are relevant to the second call for proposals to help assist in the preparation of the applications. Next slide, please. So there are a set of kind of key guidelines and tools from the Pandemic Fund that can be useful in the development of the application request. The Pandemic Fund's results framework is the overarching guidance document on M&E for everything related to the Pandemic Fund, from both project level monitoring as well as portfolio level monitoring and accountability of the Pandemic Fund investments. The Pandemic Fund M&E guidelines are forthcoming. These should be posted by the end of this week on the Pandemic Fund second call for proposals website. They'll be published in draft. And these are really useful in terms of providing more granular information on what is required, both at the proposal stage as well as the implementation and monitoring stage. So please keep an eye out for those. They may answer some of the questions that you have already. The third and the most relevant for this particular process is the second call for proposals guidance note, as well as the scoring and weighting methodology and the application materials. And today we'll be focusing primarily on the project-specific results framework template, which is a core component of the application requirements. And just to encourage really looking through the guidance note, the scoring and weighting methodology, and the application template itself, look for those M&E sections because there is quite a lot of information in there that can be useful in the development of your request. Finally is the reporting portal. And this isn't so relevant at the application development stage, but it is the primary resource for reporting on annual progress for grantees once awarded. Next slide, please. So as I mentioned, the Pandemic Fund Results Framework sets out the metrics that guide M&E for all programs, and it's divided into a set of 4 result areas, and as well as cross-cutting themes of gender equality and health equity. It includes a set of 16 standard or core indicators that all projects would be expected to report on annually, and these don't need to be included in your project-specific results framework. They don't need to be included as part of the proposal template because they're something that are reported on by all projects once those are awarded. However, under particularly results area 1, which is the demonstrated capacity to prevent, detect, and respond to outbreaks, this is where there are a set of JEE, PVS, and SPAR indicators that are relevant to the particular support types that the Pandemic Fund provides funding for. Now, for each project, the activities that are being implemented would look different from each other. And so not all JEE, PVS, or SPAR indicators are relevant for every project. So what we're asking for as part of the application is the project-specific results framework template. And this includes a set of the selected JEE, PVS, and SPAR indicators that are relevant for your particular project, as well as outlining the output coverage and milestone tracking indicators that help monitor progress toward change in the JEE, PVS, and SPAR indicators. As many of you probably know, it takes time to see change in JEE, PVS, and SPAR indicators. And so to be able to monitor the implementation of the projects, we request these more granular indicators for each project. Next slide, please. So this is a very simplified version of the proposal of the project-specific results framework template that is part of the application documents. And it's meant to be read basically from left to right. It's meant to be completed from left to right. This is in line with, for those of you familiar with log frames, of really moving from impact to outcomes into activities and even going down to inputs in the form of cost inputs in this example. So starting from the left, basically there are 3 support areas that are included in the second call for proposals, and you would use the drop-down menu to select the relevant support area for each of the activities that you're proposing. There is an option if you have a request for a support area that is outside of those 3 support areas that can be entered in manually. However, that should really be justified in the narrative of why something is falling outside of those support areas. The next is completing the high-level expected result. And this is sort of the 3-year vision, basically an objective related to that particular support area. And this is roughly equivalent to the short-term outcomes that are outlined in the Pandemic Fund results framework, or is at a similar level when you're articulating that particular expected result. Next, we move to the expected outcomes. And this is the drop-down list of relevant JEE, SPAR, and PVS indicators, as well as implementing the 717 approach. So here you would just select which one is relevant to your particular project. There is also the option of including an alternative outcome indicator if for some reason the JEE, SPAR, PVS indicators are insufficient for articulating the area where you expect to see results. Next is defining the key activities. And these are really specifying what are the essential activities that need to be implemented correctly to achieve the expected change in JEE, SPAR, or PVS indicators. Now, one of the things that we saw in the first call for proposals is that sometimes the connection between those activities and the JEE, SPAR, and PVS indicators was quite difficult to make. So it wasn't aligned in such a way that let us very easily see how these were connected to each other. In cases where that might be relevant in this second call for proposals, there's a column that includes something called a subordinated outcome. And this is something that's optional and can be used if you think that it might not be fully clear of how that key activity relates up into that higher level JEE, SPAR, or PVS indicator. Moving on to the monitoring of key activities. For each of the key activities that's defined, we ask that you identify an output indicator that can be either quantitative or qualitative in the form of a milestone or deliverable. And this is really dependent upon the particular activity that's being defined. If you could just advance one. Thank you. So in order to identify some of these indicators, we have a few suggested options. One is looking at National Bridging Workshop roadmap activities. Another is potentially including WHO benchmarks as defined by the WHO benchmarks tool. There's also a suggested indicator menu that has compiled different indicators that are currently in use by different implementing entities and global partners that will be available along with the M&E guidelines on the Pandemic Fund website. And there's a correction there. It's not actually in the portal. It would be on the website. And then other indicators that are measured by implementing entities or national systems, which really highlights one of the key principles of the Pandemic Fund, which is minimizing the reporting and monitoring burden. So wherever possible, if existing indicators can be used and are relevant, then we ask, please, that those are prioritized to help to minimize the overall burden of monitoring and reporting. Finally, if none of those really work, then there is the option of developing a custom indicator. But ideally, it's staying at that kind of higher level output as opposed to, kind of input monitoring or process indicator. And again, that it's there's a level of efficiency in terms of the monitoring practices. Then we move into the means of verification, and this is defining the data source or potentially the data, the monitoring process that would be used to report on that output indicator. The baseline information and the targets. And we do ask if a baseline is not available for any of the indicators, that there's a plan to collect that baseline in year 1. Next slide, please. So that was the simplified version of the results framework template. This is the real version. So for those of you who have already looked at this, it will be familiar to you. As you can see, it's structured in exactly the same way that I just talked through, but with additional detail on each of the columns. If you move to the next slide, please. One piece that I didn't include in the summary slide is there is also space to complete information on the responsibilities in terms of the IE, who's in charge of implementation, as well as delivery partner, and to do inputs on the associated costs. And those are broken down into those that are being requested for financing by the Pandemic Fund, as well as those that are financed by co-financing or co-investments. There's also a comments column if there's any reason that you may need to clarify any information or indicate if there are any disaggregations that might be relevant to that particular indicator, particularly when we're thinking about gender equality or health equity. Next slide, please. So last is just to say, if there are any additional questions that we're unable to answer here or that come up after this, we are available at the Pandemic Fund to respond to those questions. There is a link, there's a help desk link available on the second call for proposals page, or you can reach out to us by email. Thanks so much.
Great. Thanks a lot, Jamie. I'm sure we'll have a lot of questions, so please hang on when we get to the Q&A time. So thank you very much. Very, very clear. So next we're going to be moving on to my colleague, Peter Mala. Peter, hi, welcome.
Yeah, thank you. I hope everyone can hear me.
Yeah, we're going to hear a little bit more about the International Health Regulations Monitoring and Evaluation Framework. So take it away, Peter. Thanks.
Thank you. So next slide. So colleagues, I'll build on what my colleague Jamie has already highlighted. She's touched on what I'm going to touch on. I'm just going to probably, in a more targeted way, elaborate on some elements that will help you. So the main source of the indicators, going by the previous applications, are the IHR MEF instruments that my colleague Jamie has highlighted. So most of the indicators come from SPA. So as the first point illustrates, use SPA to select indicators for the Pandemic Fund priority areas, which are laboratory, surveillance, and human resources. Of course, there are additional areas that countries choose, but learning from what you're going to do for these priority areas, you just apply the same for any additional areas you may choose to work on, whether it is food safety, whether it is immunization, and so on. Then JE comes in for supplementary indicators that either are not well articulated in SPA or or maybe JEE has them and SPA doesn't have them, as happened with some of the indicators. You're going to see that in the next slide. Then from the same tools, because SPA reports annually the indicator scores and so on. Once you've chosen an indicator, you also should be able to observe the baseline score for that indicator, as in where you're starting from at the beginning of implementation. And then as part of your proposal, you should also highlight your aspirational target, as it were, for the aspirational target, as it were, for that indicator. Whether you want to move from the level where you are to one step over the 3-year funding period of the proposal, or you want to move 2 steps, that's entirely up to you. And then would also like to mention, as my colleague mentioned before, WHO benchmarks tool to help you identify the actions and activities. I mean, from the previous experience with the others, we find that the benchmarks provide a more logical way on selection of activities that will guide you, or rather that will lead to the level you want to get to. Because we noticed those who just selected activities based on experience from elsewhere, maybe they're targeting L2 to L4. But if you study those activities carefully, those activities should not take them anywhere beyond the next step, 1 step. So using, we are not saying you use benchmark entirely, but for each step, the benchmark tool can generate all the necessary actions that would take you 1 step or 2 steps. But once you have those actions, based on your local context, you can use them as they are, or adapt them, or adapt your activities based on what the benchmarks are telling you to come up with activities that will really get you where you are. Then, of course, as my colleague mentioned, monitor progress. We use the same tools, especially the annual SPA, because SPA is annual, and most of the progress check according to the timelines of the proposal are annual. Then that makes SPA again one of the key tools for monitoring progress. And my next few slides will just kind of illustrate what I've summarized here. So let's start with laboratory, and this going by the experience. So the idea is start with SPA to pick all the relevant indicators for laboratory. And these, if you go to the SPA document, C4.1 to C4.5 is well captured. Then if you look at SPA captures biosafety and biosecurity. But if you look at the SPA indicator for biosafety and biosecurity, which will be C4.2, which is not there, it says, it's very broad. It says something like infrastructure for biosafety and biosecurity in place. So it's rather non-specific, hence the preference to go to work with the JEE indicators, which breaks it down nicely, as other countries have done in the previous proposals. Okay, then if you go to human, so that's one, is no, just stay there. That is one example where SPA has the indicator, but JEE does a better job. That illustrates one reason to use one or both. If you move to human resource, here is a case where JEE has additional indicators which SPA doesn't have. So there's a misalignment there, but so for human resource, you're going to pick the 2 indicators that are in SPA, then you will go for additional 2 indicators which are in JEE. Next. Then for the third high priority area, which is surveillance, again, you're going to go for the indicators which are in SPAR, as illustrated there. And then there are additional indicators on surveillance, which are in JE that SPAR doesn't have. That's the AMR and zoonotic diseases. So that sort of gives you an overview of how you're going to work with this tool to select your indicators for these three high priority areas. And as I said before, if if you choose additional areas beyond these three, you'll apply the same principles, and we are here to support as necessary. Next, and I think we'll be close to the end. This is just to show you that if you follow that logical approach, then monitoring your progress will be will make your work easier. But there's a slide which I sent late. I think it's not here because that slide comes before this. I don't know if it's next. Just click next, we see. Otherwise, this would be, no, then go back. I think there's a slide on benchmarks. Just again, a pictorial illustration using human resource to illustrate to you how you would, for example, take work just using the first human resource indicator from SPAR, how you'd work with benchmarks to generate the key actions, depending on whether you want to move from level 2 to level 3 or level 2 to level 4, and then how you can, then you'll see the kind of actions benchmark will generate for you to get you there. And then you can see how you work with those either as they are or you adapt them further. So if you follow that logical step, then your M&E will be much easier, because as we are working currently, we have come up with these 3 templates. One template will simply track how you're progressing through the steps according to your proposal. You said over the 3-year period, let's say for C4.1 laboratory, you want to move from L4 to L5. Then over the 3 years, we'll just monitor how you're progressing based on annual SPAR scores, for example. In addition to that, you have a bunch of activities that you're implementing. Then we'll use the second activity tracking tool just to monitor status of implementation of those activities. And we will map your activities against benchmarks. So if you already use benchmarks, that's fine. But if you're not, because having that column on benchmarks will help us determine why you're not moving forward, because maybe your activity probably doesn't align at all with where you want to go. So, and maybe benchmark will help us to see that. And then lastly, there's a part of the proposal where you're going to set capability targets, things you will be able to do based on the capacity building efforts you're putting in place through the Pandemic Fund implementation. So again, then we have that last template that will take us through that. A fourth component that's not here is the qualitative bit, because not everything is just numbers and so on. So there's a qualitative checklist or assessment tool that is not listed here, which will capture the qualitative aspects to just make it more comprehensive. So I'll stop there and hand over the floor back to the chair. Over to you.
Great. Thanks a lot, Peter. Good. Why don't we move on to some questions that we have coming in? And again, if you have any other questions, please go ahead and put it in the Q&A function in your Zoom chat. Okay, so I think the first question will go to Jamie, or maybe first couple questions. Jamie, can we use the regional indicators for specific areas such as lab systems?
Yes, thanks for that question. So yes, within the project-specific results template, there is a regional tab. And if there are any activities that are having an impact at the regional level, then those can be included on that regional tab, and you can include any corresponding regional indicators there. And just to note that that regional tab can be used for both regional grants, where that's the primary focus of the grant, as well as country or multi-country grants that have any kind of regional component to them.
Okay, great. Yeah, very clear. Good. So the next question is, can monitoring and evaluation be costed as part of a pandemic fund proposal?
So a costed M&E plan is part of the template itself, one of the tabs in the project-specific results template. So we do ask that there's an indication of the overall cost for M&E activities. If there's a need for additional support to help facilitate more granular costing or more accurate costing to that, that is something that can be funded by the grant.
Okay, great. So our next question is for you, Peter. Will data from the indicators in the JEE and SPAR be used as part of the reporting for M&E?
I didn't get your question properly, but if I may answer it the way I understand it.
Okay.
Your proposal, you're going to work on those 3 priority areas. Let's use that as an example, lab and so on. And you're going to set your targets based on you're not going to come up with your own indicators, let's put it that way. The indicators you're going to use are the ones that are in JEE and SPAR. So obviously, if you're using the JEE and SPAR indicators, then you're going to use SPAR and JEE as for monitoring your progress, if I may simplify. And if you go to the Pandemic Fund website, you will see what we did for the first country, the first applicant. You'll see baseline analysis of where countries are starting. So there you'll see. So the same with these applicants. The moment we receive your application, we're going to do something similar for you, where you're going to see, based on JEE and SPAR, this is where you're starting. And then every 12 months, that will be updated. Okay,
that's very helpful. We have another question that's a little bit similar, but let me ask it. So if we, as in a country, conducted a joint external evaluation at the end of last year, can we just take only the JEE indicators?
The preference is SPAR. The reason is this. JEE is 4 years. There's some countries that have not done JEE at all. For example, in the past application, among the first applicants, to give an example, is Kazakhstan. They qualify, they have the money, but they've never done a JEE. So I would say to make it easier to monitor, because if you choose JEE, but if you're according to the Pandemic Fund proposal, progress report is every 12 months. How are you going to give us an update when your next JEE will probably come 3 years from now, way after the fund is expired?
Okay, great.
And then to add, by the way, over the years, I mean, I was in charge of JEE before. Over the years, JEE and SPAR have come much, much closer to each other. So that's why we are fairly confident that if you
Yes.
use far, you are not straying too far.
Yes, I understand, having gone through that process with you. That's great. Thanks, Peter. Okay, and we have another question for Jamie. Jamie, it was mentioned that the project requested under the call for proposals round 2 is supposed to be implemented during year 3. Can we get a confirmation about this?
Yes, so the grant period is 3 years. So ideally, what is being included in the proposal itself is an indication of what can be implemented in those 3 years and what can realistically be achieved within that time period.
Okay. Okay, thank you. And maybe one more question. And also, I know that we have some of your colleagues from Pandemic Fund on the line, and we have a number of questions coming in the Q&A function now. So I encourage presenters and other subject matter experts to go ahead and answer the questions, if possible, in the Q&A function. So let me go to one more question, Jamie, and then we'll go to our next presenter, Ahmed. So in the template, it says, if specific indicators within the Pandemic Fund's results framework are not relevant to the proposed project or activities, please provide an explanation for the exclusion. So does this mean that proposal writers need to include all indicators unless unapplicable? And do they need to explain the exclusion, or do they just choose the indicators applicable to the activities that they're proposing?
Yes, thanks for highlighting that. I'll need to look through and see where that would be referenced. But really, what needs to be included in there is an indication of what is being requested. So, for example, for each support area, as Peter has highlighted, there are a number of relevant JEE and SPAR indicators and PVS indicators. You don't need to include all of those in the results template. It's really just those that are relevant for the activities where you're requesting support. But thank you for highlighting that. We'll look into that.
Okay, great. Thanks a lot for the answer. So with that, we'll take a break from question and answers for right now. And we'll move to our third presenter, Ahmed from Food and Agriculture Organization. Happy to hear more about measuring animal health capacity improvement for Pandemic Fund projects using JEE and veterinary services indicators. So thank you, Ahmed.
Great, thanks a lot. It's a pleasure to be invited to this webinar series and be part of this community or contributing to it. Next slide. Okay, great. So I've structured this PowerPoint presentation around 3 main areas, kind of looking at the relationship between the Pandemic Fund M&E results framework with the IHR MEF framework and the PVS, and then the relationship between the PVS pathway and the joint external evaluation. And as an example, showcasing our lessons learned from our global health security program and sharing some of these lessons learned to maybe help you in the steps you are taking at the moment. Next. So next, thanks. So this diagram we saw earlier, I'm not going to go into a lot of detail. We know there are results and outcomes that are part of the Pandemic Fund results framework. And in line with those, there are standard Pandemic Fund indicators, JEE, SPAR, and PVS indicators that will be used for monitoring, and project-specific indicators that need to be outlined as well. Next, so we know that the PVS tool is a pathway, and it's made up of an assessment tool, and for monitoring purposes, there are follow-up missions that can be organized. And then under the IHR MEF framework, you have a number of tools. Importantly, you have the SPAR and the joint external evaluation. Next. So looking closer and under the JEE and the PVS tools, these are tools we have used under our program as well. And basically, there's a lot of similarities in the fact that they are both evaluation and assessment tools that can be organized. They're external, and the way that the documents or the assessments are set out is you have technical areas or chapters, and under those technical areas and chapters, you have a set number of indicators. And for each of those indicators, there are capacity levels or levels of advancement that can then be used to measure progress under each of those indicators. And these can be very useful as well. And in our experience, we've noticed some strengths and constraints or considerations that need to be thought of. Next. So we have really seen the fact that these are holistic, comprehensive, and provide a good overview of the health services in a country. And this can also be used in a way to standardize efforts across countries and development programs so that they're harmonized and have a consistent approach as well. Both of these tools have a role in playing in guiding the planning of capacity development programs, but also informing how M&E can be done for projects or at national level as well. And the fact that they provide an external perspective to the country on the state of these services can be very useful as well. Yeah, next. We've also noticed some limitations or considerations when using these tools for programming and monitoring, evaluation, and learning. Essentially, JEE and PVS assessments, they need time and resources to be organized. They need to be set out. The fact that baseline data and follow-up assessments are not, let's say, guaranteed to our program is something to think of and a hurdle to consider when planning, monitoring your program using these tools or evaluating them. Then sometimes the reports that are produced, you might not have access to them, or there might be a process that you need to go through to access the reports. And then in terms of measuring what they measure, they're sort of at the outcome or proxy measure of impact. They don't necessarily assess the effect of the program on the health of the population, rather than the technical capacities that contribute to improving that. And one of the difficulties we faced in our program is how to attribute any changes to the scores to actually our project interventions. So there are a number of things that we have done that have helped overcome this as well. Next. Okay, so I'm going to be going into this. This is the framework for our global health security program. Essentially, it's made up of 5 outcome areas referring to improving surveillance, laboratory capacities, response, adoption of good practices, and policy, and enabling environment. Next. And this framework is aligned both to our corporate FAO results framework, but also the JEE technical areas, so that we can use that as a way to support our program. Next. So essentially, this program is made up of 3 programmatic pillars. We have a pillar looking at risk mitigation, technical interventions for risk mitigation. Then there's a capacity building component and an enabling environment component. Our work planning is done in alignment with both the program results and JEE indicators. And at the beginning, we had a lot of challenges in terms of how do we actually design projects that will contribute to improving JEE indicator scores. And then how do we capture evidence and report on improvements and capture the impact of our intervention? Next. Essentially, next. Okay, so essentially we needed a way to strategically plan our capacity building efforts and harmonize across our project on the programming side. And on the reporting and monitoring evaluation side, we have to have a way of providing guidance on how to estimate and systematically report on them. At the same time, we noticed that some of the progress we're making is between the scores or within a score, which doesn't necessarily change the score, but still is an impact that we need to capture. And along with that, we needed approaches and tools that help us gather evidence on the actual results that are being achieved. Next. So one of the answers to this is a document that is similar to the WHO benchmarks. It's an internal document to FAO that we are using, but essentially it's a library of milestones that are aligned to different JEE indicators and show how can we go from one level to the next. And this can help us then in designing M&E frameworks, in providing guidance on how to robustly plan our efforts, and also estimate at what score we are in, even if a JEE evaluation hasn't been conducted. Next. And the structure of the milestone library was very simple in that we took the capacity levels from the JEE and developed a translation of that is simplified, and developed working with a lot of technical folks on the milestones that are needed from one level to the next. Next. Essentially, what then we have is a logical flow, and this can be used to then program work plans and interventions. So if I'm at a country at level 1, I look at the milestones that are needed to go from 1 to 2 and plan for those. And on the M&E indicator side, we'll see in the next how we actually use that. This is just another example. So you have the capacity level, which is from the JEE, then the criteria of the capacity level, which is basically just a simplified version of the capacity level to help us digest the information, and then the milestones. Next. Okay, so we found this extremely useful because it helped us to track progress across capacity levels, and a lot of the same approach can be used if you have milestones for, let's say, PVS indicators as well. Essentially, on the work planning side, using the milestones will help make sure that you have a robust plan, assess, and develop your work plan based on a more detailed framework. And on the indicator side, we have a tool to develop indicators that help us measure that intermediate step. It also allowed us to overcome the uncertainty of having regular evaluations or follow-up assessments as well. Next. Okay, so one point to just emphasize is the fact that milestones and indicators are not exactly the same thing. So milestones are more of a project management tool, and indicators are more on the performance management. But you can use a milestone to develop an indicator, and the same can be used for benchmarks. So let's say we have a milestone that requires having done an assessment to surveillance capacities in a country. Then we can develop an indicator that actually counts the number of assessments done. Next. Okay, another lessons learned has been integrating MEL and technical activities. So we know that there are technical assessments that are done. The PVS and the JEE are two examples, but there are also more detailed assessments that projects usually plan for. And within FAO, there are a number of tools. One of these tools is the laboratory mapping tool, which essentially evaluates a lab's status in line with international standards. And this is usually used to guide capacity development planning. Next, but we also use it, but it's also an opportunity to use it for M&E purposes, because it's important to emphasize or capitalize on technical activities that actually generate data. So the laboratory mapping tool, or the LMT, most of our tools are already aligned and have a place in the JEE indicators in terms of milestones, and makes it easy to link making progress on the indicator to making progress on the JEE indicators as well. So for example, from the LMT, we developed an indicator looking at number of labs that are targeted and have improved their biosafety and biosecurity practices. Next. And this really allowed us to do a couple of things. At the output level, we're able to monitor how assessments were done and provide corrective feedback when we see assessments are not being conducted. And next. Meanwhile, at the outcome level, we can then look at our interventions in supporting laboratories actually improving capacity and their performance in biosafety, biosecurity. And this is all evidence that actually supports any claims we can make in contributing to improving IHR capacities or JEE scores. Next. Now, there is a growing wealth of technical assessment tools. Recently, the guide to implementing the One Health Joint Plan of Action was published. It includes an annex that has more than 50 tools, and these can be either sources of data or tools or assessment tools that can be turned into indicators. It's worth considering this if you're developing your project-specific indicators, because it can either give you a methodology or a source of data. Next. Okay, the last, let's say, lesson learned or recommendation is to recognize the transversal role of monitoring evaluation. And we have the monitoring evaluation processes at program and project level. Essentially, they need to be complementary and to provide corrective feedback adequately at both levels. At the program level, M&E responds to the overall strategic programming and planning. Meanwhile, at project level, it's much closer to the project-specific activities and the intervention design. Next. So this basically is how we have structured our M&E results framework, starting from the theory of change, building on that with a program results framework, and project level monitoring using log frames. Next. So these are just some of the notes providing an overview of what I have described. I think some key lessons learned, just to highlight the last three, is consider integrating M&E and capitalizing on your technical activities that generate data. Consider both the role of program and project level M&E. And last but not least, think of your M&E processes before you start implementing activities, so that by the time you are getting results, you have your M&E processes to capture your evidence to demonstrate the results and their impact. Thank you.
Great. Thanks a lot, Ahmed. So we actually have a question that I think I'll direct to you. And I think it's an important one. Can artificial intelligence, or AI, be used for monitoring and evaluation for the Pandemic Fund proposals? Specifically, this question asks whether it can be used to inform labs and surveillance, but probably you can use that to, inform other areas as well. What do you think?
Okay, so there are different ways AI can be used in terms of the data analysis or getting data and analyzing it. A lot of big data, there are applications there. Then in the process of setting up the framework as well, there are tools now that you can use to actually help you design indicators, log frames, and so on. I think the recommendation here is you need to just follow the policies of your organization. Each organization now has certain policies on how to apply AI, and that's important.
Okay, very helpful. Thank you. Throughout the program, and I think in other webinars, and certainly through the literature, I think there's been much that's been said about the 717 approach. And we have a specific question about whether or not we could hear a little bit more of an explanation about the 717 approach and how it can be used to develop country proposals. So we're really happy and thankful to be joined today by Amanda McClellan, who's the Senior Vice President of Prevent Epidemics, a Resolve to Save Lives, who's developed the 717 approach. So Amanda, care to explain a little bit more?
Sure. Thanks so much, Mindy, and thanks to the collaboration with WHO around the adaptation of timeliness metrics that we call 717, 7 days to detect an outbreak, 1 day to notify, and 7 days to start response. And this is really to address the challenges that the team mentioned before, which is that the JEE and SPA only happen every 12 months or every 4 years. And how can we demonstrate that the work that we're doing is leading to improved functional capacities? So the 717 is similar to an interaction review or an after-action review, but focuses on those first few days where it's critical that we get things right. So it's a functional assessment similar to a CIMEX, AAR, IAR, but it's something that you can use every day for everyday outbreaks that really help you test the system and to make sure that you're finding outbreaks quickly and responding quickly. So there's a couple of ways to use it within the Pandemic Fund proposal. One, it helps you monitor real-time improvements and can be an M&E indicator where you show that you're improving your ability to detect and respond. But really importantly, it can give you real-time feedback on where you need to keep improving. So one of the best ways to use the 717 data is to really run a bottleneck analysis for all of your outbreaks. Every event that comes through your EOC, how long did it take you to find it? How long did it take you to respond? And then understand why you were delayed and build that back into your pandemic fund or other proposals to make sure that you're adjusting and fixing the things in the system that perhaps are causing delays. One great thing is in the data that we already have, about 75% of the bottlenecks we find are already part of the JEE or the SPA. So those activities are probably in your plan somewhere, and this might be a way to help prioritize them, lift them to the top of the pile to get them done. About 25% of the bottlenecks that come out in 717 are usually easy things to fix. People, process issues, not being able to move money, not having the right phone numbers, not being able to connect quickly. And we see rapid improvement in a number of those ways. So we'll drop some links in the chat to some more information. There'll be another webinar in the next couple of weeks specifically on 717 and how you need to build that into your proposal if you want. It takes a little bit of data management and a little bit of stakeholder engagement to get the monitoring framework up and going. We're happy to provide more details and an additional briefing in a couple of weeks.
Okay, perfect. Thanks very much, Amanda. So it sounds like the bottleneck review allows individuals to kind of really focus in on where the stress points are. But much of what you just indicated was that some 25% are about low-hanging fruit, 75% are already indicated in JE, but it just provides further focus to that area. So great. Okay, thanks a lot for joining. Okay, we just have a few more questions. I think these are mostly directed towards the Pandemic Fund around specific proposal writing questions. So, Jamie, could the Pandemic Fund Secretariat be considered as an implementing entity? And also, could you maybe have a link to the World Bank Group as well? And could additional information about the implementing entity be added post-submission of the application for the funding opportunity?
Sure, thanks. For this, I'll defer to Catherine from the
Thanks.
Pandemic Fund to respond.
So thanks. We're also joined by Catherine Hudak from the Pandemic Fund as well. Thanks, Catherine.
Hi, everyone. Apologies, my camera's not turning on this morning. So the Pandemic Fund is separate from the World Bank. So any queries about implementing entities should be directed to the World Bank. We are housed by the World Bank, but we are separated from the World Bank. So any discussion about implementing entities has to come directly to those entities. So there are 13 listed on our website. So you can go to each of their individual websites and find contact information there.
Okay, great. Thanks a lot. And then I think we have just one last question. What specific metrics or benchmarks are used to actually evaluate the effectiveness of the Pandemic Fund utilization? Jamie or Catherine?
Yes, so again, this is all outlined in the Pandemic Fund Results Framework. It includes those standard 16 metrics, and that really cuts across the capacity to respond to outbreaks, all the way down to the effectiveness of the utilization of funds. So I encourage you to take a look at the Pandemic Fund Results Framework, which gives an idea of all of those metrics.
Great. Okay. Thanks a lot. Thank you, Jamie, for your time today. Thank you, Catherine, in the background. Peter and Ahmed, we really appreciate your presentations and a little bit more clarity for the viewers on those aspects of M&E for their proposals. So as mentioned, this is one among many of in the series of sustainable financing for this webinar series for the Pandemic Fund. I believe we can show some other, we have a slide of other programs that are coming up if we have the slide set. I think there we go. All right, here's some links of templates, where the webinar recordings are located. We've collected all the questions and answers and can provide any of the documentation and templates that have been mentioned throughout the series. This is, I can't remember which one, but well into the series of these pandemic funds. We're moving on in the future to having more sustainable capacity building around developing funding proposals for the bigger picture, not just the pandemic fund. So we have one more program left next week, finalizing your pandemic fund proposal. If you have further questions, we encourage you to email us at whespp@who.int. Again, that's whespp@who.int. Please send any of your WHO related questions to that. If you have a few minutes, please take a snapshot of that QR code and provide some feedback so that we can further improve upon this series. So thank you very, very much for your time today. And thank you to all of the presenters. And thank you to Amanda for joining us as well for the 717 approach.